My name is Gail Clark. Many of you know me. I work at Littleton Regional Healthcare. I'm the Director of Marketing and Community Relations. I want to thank all of you for Zooming in tonight to our first health and wellness series, a virtual event. And I'd also like to thank Dr. Dan O'Neill, who was our presenter tonight. The topic that he'll be talking about is extremely important, and I think now more than ever after a year of really probably not a lot of activity for many, many families and of course children. Dr. O'Neill is an orthopedic surgeon. I believe he's been practicing for 30 years. I hope
yes, north of 30.
Well, that's okay. More than 30. And I'd also like to thank the LRH Auxiliary. The auxiliary was generous enough to sponsor this event and the 3 other wellness series we have planned for this year. One in June, one in September, and again in December. So special thanks to the LRH Auxiliary for their generosity. I'd also like to introduce quickly Heather McKean. Heather is the marketing manager here at LRH, and I'm going to actually turn it over to her quickly before Dr. O'Neill starts, so she can just briefly tell you how to join the chat if you have questions. So go right ahead, Heather.
Following Dr. O'Neill's presentation, we will do a question and answer session. There should be a Q&A feature as well as a chat feature at the bottom of everyone's screen. I'll be monitoring both, so whichever is easiest for you to submit questions, feel free to do so. And then after the presentation, we'll go through that as a group.
Thank you, Heather. One last thing, everyone that attends tonight will be entered into a raffle. And thanks to Dr. O'Neill, he is going to provide 3 of his books. And if you are fortunate enough to win, we will get that off to you in the mail. And I will turn it over to Dr. O'Neill. Thank you.
Great. Well, thank you, Gail and Heather, and thank you, the auxiliary. I want to rest on this title slide. Usually we zip right by it, but in this case, it's important, and I make mention of this in the book. Health and wellness is something that my colleagues and I have not been particularly good at. And you also notice the change in title, a name of the hospital from Littleton Regional Hospital to Littleton Regional Healthcare. And that is also reflecting what's happening and what should be happening in our healthcare system. It should be about health and wellness. And the phrase I use in the book is we've been playing whack-a-mole with disease as physicians and nurses and public health people all these years. But really, if we had been emphasizing health and wellness, we would be not in the mess that we're in now, but also in a lot of other messes wouldn't be present. So we have a problem, and our problem is that our children don't have any health and wellness. And I'm going to focus for sure on this generation that we're looking at the school bus stops and everywhere, and where you see young people. 30% of these children are overweight, 20% are meeting the criteria for obesity. And what that means is that they're dragging in all of these so-called Western diseases or diseases of civilization, as it used to be called. The problem is that this generation will have a shorter lifespan than the last. That's an extraordinary statement. We have never been able to make that statement before the plague. So for those of you who remember the plague, yeah, we could make that statement then. And even with the pandemic and with everything that's going on, when we justify for that, it's still, the pandemic exposed a lot of issues. And here I say racism in our nation's school, people of colors in poor communities, but and for sure in our state, in New Hampshire and Vermont, we could call it a form of racism. I decided years ago I was not going to pay any more attention to the Claremont lawsuit and the way education is funded in New Hampshire, because like so many other things, they kept saying the same things over and over and over again. And every year there'd be another bill through Concord and nothing ever happened. Well, it's still not happening. And the poor keep getting poorer, and the people of color keep getting less healthy. And again, we know this from the data. We know that the children who died of the pandemic were obese. We know that the majority of the adults were poor. We know that a plurality were Black and Hispanic and American Indian, and this is what's going on. So here's part of the problem. When I was a kid and I used to steal cigarettes from my parents, they were worried about me getting lung cancer when I was my age, when I was in my 60s or 70s. These children are sick now. We mentioned diabetes. They have high blood pressure. They have depression. They have high cholesterol. These are adult diseases. These children should not be burdened with these, and it's a burden that we've given them. This is a tough thing to say in the pandemic, but if we harken back to 2019, we made a big deal about the measles epidemic. 1,000 cases of measles in the United States. We made this huge deal, whereas we have millions and millions of cases of diabetes and high blood pressure in children that nobody's paying attention to. So here's one of the issues. You have not changed significantly in the last 200,000 years. We have not evolved as a species in the last 200,000 years, and we evolved up to be hunter-gatherers, and we were really good at it. We have these long legs and these big butt muscles, so we can walk and run a long time, and we can outrun animals, and we can stand in the fields, and we can pick things off trees. So we were really built to be good hunter-gatherers. Our teeth are good for a wide variety of foods that we can eat. People shoot today for 10,000 steps a day. It's twice that when we were hunter-gatherers, and that's when we were healthy, when we ate unprocessed foods. So the bottom line is, if you survived through childbirth, and if you survived, poisonous animals and leopards and that sort of thing, you actually were very healthy and would be one of the top athletes in your school now as a hunter-gatherer. But what's happened to our hunter-gatherer bodies? We've gotten crushed by this two-headed monster. And that two-headed monster is ultra-processed foods and screen time. And this is not news to anybody, but the breadth of this problem, the sheer heft of this problem is absolutely extraordinary. We are losing the battle to Steve Jobs and Ronald McDonald because they have more money than we do. They have smart people, and these smart people and these billions of dollars are telling our kids to eat bad food, telling our kids to stay on Facebook, to stay on YouTube, to stay on Call of Duty. As adults fighting this, if we go down to the high school tomorrow and we grab a 16-year-old who the teachers say is addicted, good luck. This child is truly addicted to these problems, and stopping them in the middle of that is a battle that I know many of you out there are having, but it is a battle that you are not equipped for because of the Silicon Valley and the ultra processed food people. So here is the solution. The solution is we don't take that fight. The solution is we never let our children become addicted. The solution is we use a positive, and that is what I call physical identity. You were born with a physical identity. You were born wanting to crawl and grab things and eat dirt and explore and smell things. This is what you do. This is what every 2-year-old does. If we can make sure that that 2-year-old does not lose their physical identity, they're going to make choices of better foods. They're going to make sure they're out running in the woods and doing things that hunter-gatherers and normal children and normal people do. It is what is in our genetics. So hopefully you have a physical identity. Hopefully your children do, but unfortunately, they would be in the minority. So this is a perfect example of the 80-20 split, like everything else in the world. And unfortunately, 80% of our children, 80% of our population have lost their physical identity. The adults can deal with that because of some things we'll talk about in a few minutes, but the children cannot, because these children can go now from 2 years old to the grave without doing anything physical. If we don't allow children to lose their physical identity, they're going to grow up again being those busy, inquisitive people that they were born with. Not only is physical identity an issue with obesity and again, these Western diseases, but what's going on with our young people today? Stress, depression, incredible suicide rate. And something that we should all be interested in is academics. These children are not doing well in school because they are not healthy enough to do well in school. Kids love video games. They call them exciting and interesting, and they love them for a lot of reasons. And I'm the first one to tell you I am a non-combatant on this one. I don't play video games. I don't really get it. If I have my choice, I want to be outside doing something. And Mother Nature can beat out the forces of Facebook and video games if the children never become addicted. And I'm going to keep using that word very purposely. It's an addiction. We can't let them get addicted. Like every other addiction, stopping it is brutal. We start today, and again, all of you out there, start today with what I call the 200-calorie surplus, because there's so many things we don't do that we used to do in the old days. With kids, the biggest thing kids don't do is play on their own. They don't play pickup games on their own. Obviously, they don't do morning chores. That might be something you can address. But what I'm going to talk about as my solution to this, and one of the problems is that they don't have any physical education. So they're just not burning those 200 calories. For the rest of us, we don't burn those 200 calories, and that's why there's so much obesity in adults. And again, you can make a list of 30 things that we didn't do or 50 years ago that we did 50 years ago that we are not doing today. And all these silly things, shifting the car and getting up to change the channel on the TV, they all have a calorie count, and that calorie count is, 5 calories, 10 calories, but it adds up to 200 calories at the end of the day. So we all have to pay attention to this. So I'd like to say this is the most important slide in the show, but there's a lot of important slides in the show, but this is one of them. There is no STEM without fitness. STEM is science, technology, engineering, and mathematics. So the big buzzwords in education is STEM. And in 2002, with No Child Left Behind, the whole concept there was to improve our STEM scores, to get the American kids rivaling the Indian kids and the Chinese kids and the African kids and the Norwegian kids, and to get us up so we're up to speed with them. Clearly, we're up to speed right now, as we know that the Googles and the high-tech firms are based in the United States, but there's not enough Americans to fill the jobs. And so, again, you might have heard about this in the last few years with all the visa issues. There are 100,000 Indians signed up to get visas to the United States, and all of those people will have a job when they get here in the tech industry. America is not producing enough STEM scholars to fill the jobs here. they're not fit enough to be STEM scholars. And public school physical education is, to my way of thinking, the only hope. The other point I'm going to try to make here is that we need to think about physical education first, PE for every kid every day, every year of school, and then school sports second. So the world has changed. A school's PE program should be a key component to continue physical identity, but we are stuck in the past. Again, what happened in 2002 with No Child Left Behind? Well, we wanted to have better math scores and better English scores. So what did we do? We took time away from physical education, the worst thing we could do. And what happened to our math and English scores? Nothing, or maybe they went down. So we're fighting Croatia for that 37th spot in the world in terms of math equivalency. If a doctor from 1921 came into the operating theater at Littleton Regional Hospital, they wouldn't know where to go, what to do. They wouldn't have a clue. They would be absolutely lost. If a nurse went into the ICU from 100 years ago, they would be lost. Physical education is the only profession where if a teacher from 100 years ago showed up, they would be horrified. They would be horrified not only by what the kids look like, how the kids moved, but they would be horrified by how much is not happening, how little the kids move in the PE class, and what the kids are doing and not doing in the PE class. And this is not for want of education. The students that are coming out of Plymouth State and UNH and Lyndon State College, these students with their PE degrees are brilliant. They have an incredible background. They have a background not just in physical education, they have a background in anatomy and physiology and sports medicine and sports psychology. But when they get to that school, they are not allowed to use that. And this is one of the reasons why we are seeing fewer and fewer PE majors in our colleges. So what happened? 1866, California. Like them or not, Californians are always ahead of the curve. And they required 2 PE classes a day. In my book, I go through a number of states, but if you're bored, punch up the PE requirements for New Hampshire and Vermont and Massachusetts. It's not there. The only state that required PE for every child, every day, every year was Illinois, and that was only for a short period of time. And then they've since backed off because of grief from the schools. Again, exactly the opposite of what we should be doing. The data is in. This is not Dr. O'Neill's opinion. I'm not coming up with this from what I observed. This data is every country that's done the studies. This data is national. This data is available for any of you to look at. When I give these talks and when I wrote this book and was doing the research for this book, nobody's arguing with me. Anybody who's in the business knows what the problem is, yet nobody is doing anything about it. Nobody's asking for the schools, and that's what it really boils down to, the school districts to make the commitment. What we talked about before, the PE teacher, 11 minutes of motion in a PE class, 16 minutes in another study. This is not going to maintain physical identity. We have the money for a physical education class for every kid, every day, and every year. The problem is that money is being spent on a minority of students. 86% of our school budgets are going towards sports, not physical education. Now, if we had a school full of fit kids, great, we could afford to do that. But we have a school full of sick kids. And again, this is not a city problem. This is a Littleton problem. This is a Profile problem. This is a Plymouth problem. This is a every town USA problem, save for very few. Only 16% of our high school kids are playing 3 sports. They need to play 3 sports to see those fitness benefits. And this is from a study I did for the book. The other problem we have, and this, again, I go into a bit more in the book, and it gets a little bit complicated, is this concept of athlete and non-athlete. When I was a kid, and again, I'm sorry for saying that, if you did not play organized sports, you were still playing. You were still riding your bike. You were still running around. You were still playing army. You were still getting dirty. You were still building forts, and the cities playing hopscotch and skip rope and in the playground. What's happening today is the playgrounds are empty. The fields are empty. The kids that are not, and the only time you see kids on the fields are when there's an adult there with a whistle. What the kids are doing, the ones that are not on the field, are inside playing those, quote, satisfying, unquote, video games and being on Facebook and being on Twitter. Another study I did for the book, and again, we're not going to spend a lot of time on this, is when I say that we need to make school sports second, you'll say, well, what about the kids that get scholarships, and aren't school sports really important? Well, the school sports are really important for kids that have already achieved a certain level of expertise in those sports. Most of our sports teams now, most of our varsity sports teams are filled with kids that have been playing travel teams and AAU and other Pop Warner and other sports that their parents paid for. So unless you have money in America, you're not going to play even on a high school team and see any real minutes in the vast majority of cases. Now, the study I did for the book was looking at what I deemed suburban sports: soccer, field hockey, lacrosse, baseball. We looked at golf, we looked at tennis. These sports are already going to the halves because you don't make your high school soccer team in many venues, any place south of Concord for sure, where the high schools are bigger. You're not going to make that starting 11 unless you've spent a lot of money and played a lot of soccer before that. The other thing that I'm not going to spend a lot of time on, but this idea of the haves and the have-nots, is that I did not look at football and basketball because those tend to be outliers. Although at UNH, I would virtually guarantee you the kids at UNH are not poor kids that need this scholarship money, but we're paying for them anyway. And oh, by the way, between 6 and 12 colleges make money from their athletics. Texas and Ohio State make money every year. But after that, between 4 and 10 make money. Colleges are not making money on athletics. It's a money sink, and it's going to the haves in the vast majority of cases. Again, these are the kids that are getting the college scholarships. Amanda's parents, if they had saved all the money they spent sending her to travel teams, they could have sent her to any college they wanted. But we're getting off a little bit. The role of public elementary schools and public high schools is not to produce athletes for the Olympics or for UNH or for the Bruins. The point of PE is to make sure our kids are healthy enough so that they know how to exercise and they're healthy enough to play sports, and for Pete's sakes, that they're healthy enough to do algebra and read Toni Morrison. We need physical education for every child every day now. We cannot have another generation that's going to see a shorter lifespan. JFK, and actually it wasn't JFK, it was Eisenhower who saw this. Eisenhower, obviously a great general, looked around, he says, television has been invented, there are fewer farm jobs, there's more automation in our factories, people are getting soft, what's going to happen for the next war? So Eisenhower started the President's Council of Physical Fitness, and then Kennedy took it to the next level. The problem is that Kennedy and Eisenhower had no jurisdiction telling schools that they need to make sure these kids are fit. They just have a bully pulpit. And in fact, our state, There's only one state in the union, and it's Hawaii, that where the state dictates what happens in the schools. Other than that, it's school districts. And to my mind, if a school district is not graduating kids that don't have high blood pressure, that don't have diabetes, that are not depressed, that are able to do a squat and a plank and some push-ups and sit-ups and maybe a pull-up and are able to swim and cycle, that is a sixth grade reading level. That's a sixth grade reading level. We should be graduating children that are able to go out in that world with some level of health, with their physical identity intact. And then everything is going to go better. And when I say everything, I mean physically, psychologically, and economically. And I'll just touch on that in 2 seconds. Silicon Valley it was a big part of making this mess. Silicon Valley should help change it. I know many of you are thinking, man, I hated gym class. I hated PE. So let's rebrand it. Let's make it into something exciting and fun. And in my book, I give examples of how that works in detail. So any superintendent out there, any principal, any PE teacher, any classroom teacher can pick up my book, and there's a template for what to do in a physical education class. And again, this is not magic. The students know this. They're just not given the chance. And when the PE teacher sees children once a week, once every other week, and in high school, maybe 1 out of 4 years, 2 out of 4 years, that's just not getting it done. But again, this is our trump card. Mother Nature beats out video games if we give her a chance. And I understand that I'm talking to the wrong audience here, because I understand, save for mud season, that we live in a beautiful place, and we live in a place where we want to be outside. And again, hopefully our children want to be outside, but it's not even happening with all of our children here. And it's everywhere in the country, and it's everywhere in the world. And even with these other countries like China and India, when they develop their middle class, they have more obesity, they have more heart disease. So it's literally a worldwide problem. So in conclusion, obesity and poor fitness is an expensive and dangerous national concern. We talked about the problems with the military. 4 out of 5 kids that walk into a recruiting office are not eligible for the military because of obesity. It's expensive. It's costing us billions with a B. And I know that's not a big deal anymore, because we're talking trillions now of late, but billions. This is a lot of money on healthcare costs, on psychological and physical healthcare costs for our children. Number 2, our children are addicted to this stuff. Number 3, there is no STEM without fitness. Number 4, we're not going to cure this with a negative. This is not a just say no. We can't cure anything with a negative. We can cure it with a positive, with physical identity. Number 5, you're not a non-athlete at the age of 7. Number 6, our only hope for maintaining our physical identity is physical education in our public schools for every kid, every day, high quality physical education, 30 to 45 minutes of getting that heart rate up every day, adding to that a recess period, adding to that a pre-school period. And the kids, when they leave that gym class, when they leave that recess, when they leave that early morning runaround period, that next class, they drill it. Those kids are ready. They're not amped up. They are ready to learn. That brain is turned on, just like their heart and their muscles are turned on. So here's the problem for you guys for showing up at this talk. You are now part of the revolution. You are all deputized. I need you to go to my website, survivalofthefit.net. I need you to download the letters. We have templates there. You can download them onto your computer and then customize them. Send them to the superintendents. Get a copy of the book, put it on, give it to the school board, give it to the PTA people. Let them call me, and I'll give them a talk like this one. We cannot wait any longer. We need help. We need to make this grassroots. We are going to introduce legislature this autumn in Concord, and you all know what's going to happen to that. It's going to get beaten. It's going to be, eliminated very quickly. But then we'll, of course, do it again next year, and eventually maybe we'll get something coming from the top. But if we get something coming from the bottom, if Governor Sununu and people were getting letters talking about this, and they start seeing this, and they saw this again, now we have a revolution, and now we have a generation that's going to be healthy and happy. So that's it. Thank you so much. Questions, comments? Surely I've said something that you disagree with. So shoot.
See, I do see 2 questions in the chat function. The first is, in the book, you suggest a long-term negative effect of childhood obesity could be the depletion of our armed forces, since many young people won't meet the physical requirements for service. Is there a role that the U.S. Armed Forces can play in pushing this PE revolution, be fiscally or via marketing, etc.?
Yeah, that nobody's ever asked that before. That's great. Yeah, the U.S. government has to get involved. When Kennedy got involved, when Eisenhower got involved, 4,000 schools ramped up their physical education programs. And again, I don't want anybody to be wincing about the fitness test. The president's that was not what Kennedy really had in mind, and that's not what was supposed to really happen. But in other words, the research and the PE test that they recommended to Eisenhower and Kennedy, it just got morphed into that test that many of you hated, and I couldn't pass and get the certificate. But yeah, for sure, if we had this same energy at the federal level, just like we were talking, if we can get that energy at the grassroots level, and if we can get somebody at the federal level, but the President's Council has been depleted, and Schwarzenegger was involved, and some real high-level athletes were involved over the years, but sadly, even though young George Bush, old George Bush were athletes, and Gerald Ford was an athlete, this last 4 years has just, it's taken it off the screen for any interest. But yes, any influence is going to be welcome.
The next question I see is, a participant would like your opinion on outdoor exercise in vacations. Parents are busy at work.
Yeah. So two things for that. Number one, our kids today don't know how to exercise or play. It has been eliminated from their repertoire, and it's horrifying. So, and we see this, and we're all guilty of this. I think our generation, when I say our generation, I mean the 50 plus out there, have been guilty of maybe giving our kids too much attention and making more organized sports, and organized sports has taken over to the point where that's the only thing children understand now as activity. They don't play on their own. Again, harken back 25, 30 years ago, the kids that weren't interested in football, and weren't interested in ski racing, and weren't interested in these other things, what did they do? They started snowboarding, they started mountain biking, they started doing these alternative sports, skateboarding. And then what happened? They put it in the Olympics, and now it's just as organized as anything else. So even our alternative kids have been brought into that fold because, and again, I talk about it a little bit in the book, but I try not to harp on it, the sports industrial complex. There's a lot of money to be made on this. And Nike has recognized this, and Under Armour has recognized this. And by the way, yes, I have reached out to Bob's and Nike and tried to get them to talk to me about this, because in my way of thinking, because we're eliminating 80% of our kids from playing. Nike and Under Armour would be selling a lot more product if we brought them into the fold, but they're so focused on the organized sports. And again, I'm not opposed to organized sports. It just can't be the main purview of our schools because our kids are not healthy enough even to play organized sports. And again, we can go on and on down that rabbit hole, as you might imagine. Getting back to the military question also, if you talk to any of these people in power, they all know it. Why the Pentagon is not the Pentagon has not been pressuring these last few administrations harder for health, that I don't know. Yeah. Next question.
So we have a question here. Are there any states that are doing better with this? And a follow-up question to that, or any schools that you know of that are trying to increase their PE time?
So this is really embarrassing, but if you read my book, it talks about Illinois as being, that state up on the hill that is showing us the way. And if you read, I don't know if they're still up, but when I was doing the research for the book, and this was 2017, 2018, the state standards for PE in Illinois were brilliant, and they did not mince words. They said, we're the third fattest state in the country. We are spending $14 billion on healthcare for our kids. We are failing. And that's why we are mandating PE for every kid every day. And the problem is they can't mandate as a state, but what Illinois did was they got it into law. So I came across something a few months ago after the book was already with the printer. Yeah, Illinois backed off on that. And now they're not pushing the school districts to do that. But to answer your question, Naperville, Illinois is the poster child for this. Naperville, Illinois does this. And what's their obesity percentage? 5. Where do they rank in terms of academics? Right at the top, in the top 5. Now, the problem is Naperville, Illinois is an outlier. It's a rich suburban district, and they can do this. And if you punch them up and look at some of the YouTube and other video, they have a big pool, they have kayaks in the pool, they have weight machines and treadmills. So they're a real outlier. But we know that it works. And again, the studies, we don't need any more studies. And yet so few schools are doing this, to answer the second part of your question, which is why I wrote the book. And the problem is that we know what we know what the problem is, but everybody is afraid to say that the emperor has no clothes. And in this case, the emperor is organized sports that's sapping all of the resources from our district, our school district budgets, and putting it into that small percentage of kids. And people are afraid to say that. And they're also afraid to say that Sodexo is not your friend, that the food industrial complex is not your friend, the sports industrial complex is not your friend. Anything that has industrial at the end of it is probably not your friend. And so as long as we are not making the investment in our cafeteria, and we're not making the investment in our gym and our PE teachers, we're going to lose, and we're going to lose another generation. And I wouldn't care if these kids were, you know what? Video games are so much cooler than going skiing. If that was the case, I would say, okay, fair enough. But that's not the case. These kids are miserable. These kids are depressed. They're anxious. They're not happy children. Being on Facebook all day does not make a child happy. Getting out and being in the woods and going for hikes and being out in the playground and kicking a ball around, that's what makes kids happy.
Let's see. The next couple are more comments than anything, but I want to make sure they are mentioned to the group. We have a thank you, Dr. Neal, for championing this effort. And this was so eye-opening to me. Thank you so much. Another comment, but still important, I'd like for it to be shared aloud. Hospitals can help by encouraging physical activity at the pediatric level and sharing information about the importance of this at a young age, but we all need to do more.
Absolutely. Thanks, Heather. And thanks for those comments. And you're right. As I said, the doctors, we have to do a better job. And I've tried, I've been in touch with some of my pediatric colleagues and tried to get this going. It's all of us. And again, for any of you who are excited by this topic, please email me, go to the website, get involved. I will do a lot of the heavy lifting. I will badger your superintendent or your principal. We're giving some presentations to schools. We're already lined up to do something for the Littleton Park and Rec this summer. Liz is going to come up with me for that. We're doing something in Conway. This can happen. This revolution actually can happen. And it'll be a fun revolution, I mean, it's because it's good for all of us. So, so thank you so much again, and keep my feet to the fire, and put everybody's feet to the fire, and I would love to see this happen. So thank you so much, everybody. Appreciate your help.
Let's see, I have another comment from a fellow physician. Great talk, very timely. Let's see, this one individual believes you may have already covered this, but I'll read it again aloud just in case. Schools are cutting sports because of money budget cuts. How can we get these kids moving more without sports in school, especially during COVID?
Right. Show me, right. So, and if you're going to cut sports and put it into PE, I'm okay with that. And then the community has to step up and do the organized sports. We do it already with Pop Warner and Little League and the Jets program at Waterville for skiing and Franconia Ski Club, et cetera, et cetera, et cetera. And so, in other words, it's there. We have to make it so it's not that finances are not a limiting factor for any of these things. Every kid in New Hampshire, if they want to ski, should be able to ski. But that again is another topic. But you're right, they're cutting out school sports now. We've already cut PE, and now they're getting rid of school sports. And now, as you know, they're getting rid of art and they're getting rid of music. This is just unacceptable. And again, we're spending the money on the other end. We're spending the money on psychology services. We're spending the money on medical services. We're not saving any money by getting rid of PE, by getting rid of music, by getting rid of sports. Again, the venue for the sports we can argue about. We're not getting rid of, we're not helping, we're not saving money. That money, it's costing us a fortune. And again, if nothing else, people are just not having as much fun. It breaks my heart when I see kids today that not having as much fun as I did as a kid. And that just doesn't seem right to me. So let's end this on a positive and let's go out and get some things done and download those letters or write your own letters and get me on another talk somewhere and again, get this book in front of your anybody with young children, especially kids, really young children. They need to read this book, and those parents are going to go and say to the school. And so, by the way, real quick, what I see happening, a low budget way of making this happen is making sure that when the kids get to kindergarten, they have their 2 exercise periods a day. And then the first graders, every kid in first grade every day. And then next year it's the second graders and the first graders. And the next year it's the third, second, and first graders. So in other words, we don't have to turn on a dime here. We can do it gradually, and that's going to bring in the budget will change gradually. We'll be able to make allowances for equipment and everything else. But this is cheap at the end of the day in terms of what we can do for the health and happiness of our children, and again, to save money for the doctors.
I do see 2 more comments or questions that really go hand in hand. What do teachers say about having PE in the morning before math class? And then to follow up to that, Dr. O'Neill said that the heart rate had to be up prior to studying math, for example. That means STEM teachers and PE teachers need to pair up at some point.
Yeah, that's good. But you know what, the social studies teachers will be jealous then, because the kids they're ready to go. But and that's why you bring up the point. So the schools should be open, and there can be paras there, or somebody who's not in the less expensive than a teacher or whatever. Again, because we do have to talk about money here. There can be somebody there, and they're going to be, and by the way, there are volunteers. There's plenty of adults out there that would volunteer, plenty of parents who would do it. But anyway, they should be there a half an hour before school starts, and let's scratch up the gym floor in the wintertime. Let's make sure those kids are running around every other time, getting things revved up. Then they go to their first couple of classes. Then ideally, every kid would be doing PE at 10 o'clock, but that's not realistic. But you can rotate the schedule around. There's so many things that we can do. Once all the classroom teachers understand and see that if that child does not have their brain warmed up and ready to learn, they're not going to learn. And the way to warm up that brain is with physical activity. By the way to beat off Alzheimer's is, guess what? Physical activity. You can do the Sudokus, and you can learn Japanese, and you can learn the piano, and those are all great. But guess what? All the evidence points to the most important thing being physical activity for seniors to beat off dementia. And why would it be any different for children? It's the same exact physiologic mechanism.
I don't see any other questions or comments beyond the ones that we've covered, but I'll keep an eye on it for the next couple of minutes. If you have any final points, Dr. O'Neill?
No, I I can only talk about this for another 6 or 8 hours. So no, but it really, shoot me an email if there's any other questions. Criticize me. Tell me why it doesn't work, because when you tell me why it doesn't work, then we can figure out a way to make it work better. And that's what it's all about. This is not nothing is set in stone, and things are going to change depending on where you are. But we've got to do something, and we've got to do something, as soon as possible. And again, this is an inexpensive solution to a big time problem. So thank you.
Thank you, Dr. O'Neill. That was
All
very
right.
good.
All right, great.
Thank you very
Well, I
much.
want some emails. Thanks,
Okay.
guys. All right,
Yep,
I'm going to
thank
sign.